Hello, everyone. Welcome to Endwell Live, where each week we're having a conversation with a special guest about how, in this truly unprecedented time of crisis, we can collectively find community and best support those facing serious illness, support caregivers and families. I'm Shoshana Ungerleider. I'm a physician and the founder of Endwell, where we're focused on making the end of life a part of life. And I hope that you're all safe and healthy. And if not healthy, I hope that you're on the mend. We're coming to you today to find community in one another and to support our physical and our emotional health through this virtual conversation. So today I have the pleasure of speaking with Dr. Bon Ku, who is an emergency medicine physician and the founder of the Innovative Health Design Lab at the Sidney Kimmel Medical College at Jefferson University in Philadelphia. He's the co-author of Health Design Thinking. And we're gonna talk for about 20 minutes and then open it up to you all, our audience. So please say hi right now in the comments and tell us where you're from. And be sure to enter your questions or your comments down below. And then go ahead and share this Facebook Live link on your own page so others can join us. And I want to say thank you to the Cambia Health Foundation and the Tauber Family Foundation for their support of this program. So hi, Bon.
Hi, thanks for having me, and hi out there to everybody.
So tell us, where are you joining us from today? And of course, how are you doing with all of this?
I'm joining you from Philadelphia, Pennsylvania. I've been working in the emergency room during this time. I worked a string of shifts earlier the past few weeks, and this week has been nice. I've been getting some sleep and rest, so it's been really nice to do that.
So things have been calming down a little bit.
It has been. It
Yeah.
was in late March, we started to see an influx of COVID cases, and the past couple of weeks, we've seen a steady decline in COVID cases. And what's been actually refreshing is that we're starting to see an increase in volume of patients coming in with what they would normally come in with to the emergency department, because overall our volumes have been down as much as 40 to 50% on some days.
Yeah, you know, you're the first ER doc we've had on Endwell Live, so it's interesting to hear how it's been going. And I know out here in San Francisco, where I'm coming from, you know, our emergency room, the volume has been down as well. Even with I think we forget that, of course, people are dealing with other chronic medical problems or acute emergencies that come up, and so many people have been avoiding coming to the emergency room because of fear of infection risk, and they're not getting the care that they absolutely need. And so it's this sort of difficult situation that we're in terms of encouraging people, if you need help, my goodness, come, we're here for you. But our ERs have been quiet as well. So it's definitely an interesting time.
Yeah, we've been telling patients that they can come to the emergency department if you do have something that you're concerned about. We'll do our best to protect you. You're going to be safe.
Mm-hmm. And I know you train medical students and residents there. It's probably too early to know, but do you have any thoughts about what long-term impact that these experiences might have on frontline clinicians and trainees based on what's gone on over the last few months?
Well, there's been, as anyone involved with this, a lot of anxiety, emotional strain, just stress during this time, and especially those who are at the epicenter in New York City, where I trained, in New Jersey, where they've seen a high number of cases, which is right next to us in Philadelphia. And I'm concerned about the mental health of physicians, of nurses, of other healthcare workers. I'm not an anxious person, but over the past few months, I felt a lot of anxiety about, am I going to infect my family? How do I keep safe? Should I stay at home? Should I not stay at home? And speaking with my colleagues, I know there's been a lot of concern over our trainees, resident physicians who are really at the front line taking care of patients with COVID, and them being at so early on in their careers, some of them not having the full personal protective equipment that they need to take care of these patients, that I'm deeply concerned about. What are the long-term emotional and mental health impacts of COVID-19? And there's such a problem with stigma in medicine that we are afraid and ashamed to admit when things are going wrong, emotionally for us, or on a mental health. And I fear that frontline healthcare workers will not seek help when they do need help after this.
Yeah, I've felt the same way in talking with my colleagues around the country, and definitely trainees who are spending 80 hours a week taking care of patients on the front lines. I mean, it just blows my mind, having been there myself a handful of years ago. I know it's so hard to even just get through a regular day when you are underslept and really just focused on work all the time, and then to have this crisis happen in the setting of not enough PPE, in the setting of heightened anxiety all the way around, with our own safety, the safety of our families. I mean, it's so much to even think about. I can't imagine being there, especially in New York City and where you are with the volume of cases. I do know that a lot of places have created programs for people to be able to get mental health support for free at any time, day or night. They can text in, they can call in. But I think we're going to continue to have to normalize that, those safe spaces for people to really reach out for help. And that needs to be modeled from the administration, that's okay to do. And it's in fact encouraged.
Yeah, I think we need
Excuse
to
me.
create those conditions that invite people to seek
Yeah.
help when they need help, without that stigma, to normalize that behavior, which it hasn't been done in medicine. So I think it's, yeah, very, very important for us to do that.
Yeah. If you're just joining us, I'm talking with Dr. Bon Ku. He's an emergency medicine physician and author from Thomas Jefferson University in Philadelphia. Please share this live conversation on your own page so others can join. And please say hello, tell us where you're from, and ask your questions below. Bon, so tell us about your family. Your parents are living in South Korea now, right?
Hmm. Yeah.
And has this given you insight into that nation's response to COVID? And what do you think is working in South Korea, and what might we learn from their example?
Yeah, my parents are immigrants from Korea, and they moved here so I could get a better education, and they moved back years ago to the country. They're out in the country. They're not in Seoul, the capital of
Okay.
South Korea. And initially, when the crisis, the pandemic occurred, I was super concerned about them, because at one point, South Korea had the highest number of cases in the world outside of China. And I was deeply concerned about them getting infected with COVID. But now it's the opposite. I called my mom a few days ago, and she's worried about me and about me getting infected, and I'm not worried about them at all. They're very safe. I think
Good.
South Korea has done a world-class example of how you crush the curve. They've what's crazy is that the US and South Korea had the first confirmed COVID case around the same exact time, and already kids in Korea are starting to go back to school, and we
Wow.
are nowhere near that. They've just done a great job of testing, of contact tracing, and separating the sick from the well. And what's been amazing about South Korea is that there was actually never an official lockdown, but that the citizens felt that this was the best thing to do for public health, and they did a great job of keeping the politics out of this crisis, of keeping the politics out of public health. And because of that, they've been able to really crush the curve and have far fewer cases than we have.
Yeah. Well, we clearly could take a lot of what they've done and use it over here. That's for sure. But we'll see. Everything that you mentioned, the testing, the contact tracing, the separating when we start reopening is so critical. So I'm hoping that we'll get to a place where that happens here. I'm glad to hear that they're safe.
Yeah,
So
yeah.
switching gears a little bit, you wrote a book, Health Design Thinking, which is there behind you, with design curator and writer Ellen Lupton, that came out just a few months ago. That's fantastic. Congratulations. Are there ways that we might design better facilities for catastrophic public health crises like the one that we're facing? And can design help prevent transmission, both in public spaces and healthcare facilities?
Absolutely. In our book, Health Design Thinking, my co-author Ellen Lupton and I, we have some case examples of how architecture can improve health outcomes. We talk about how the physical space of hospitals impacts health outcomes like C-section rates, and how the physical layout of hospitals can improve the patient journey and experience, and for both clinicians and patients. And I think looking at how healthcare facilities are designed, that we need to do a better job. We need to design hospitals and clinics that protect healthcare workers, that protect patients from getting infected if they were to seek care. I think that's a big problem that's going on right now. A lot of patients aren't coming to hospitals because of this fear of getting infected. But I think we can use architecture, we can use the design of spaces to better protect us. A couple of practical things is, how do we design facilities that separate those who can potentially infect other patients? And how do we create these hot and cold zones? We've been doing that in a lot of emergency departments across the country, where we currently have a hot zone in our emergency departments. Anyone who has signs and symptoms of COVID, go to that hot zone. If you don't, you go into a cold zone. I think that's going to be the new normal. And how do we make our healthcare spaces a lot more flexible to meet surge capacity? We've seen just a lot of creativity going on with hospitals to meet surge capacity. We've seen gymnasiums, parking lots, parks being converted into these mobile hospitals. But I think we could do a better job at that, of these permanent fixes in the built environment of hospitals, that we can instantaneously convert these spaces to meet surge capacity, that we could protect our healthcare workers. Currently, there's an opportunity here, and I'm optimistic that going forward, that we're going to be redesigning a lot of the spaces that we work in, a lot of the spaces where we go to get treated in.
Yeah, I hope so. I think that the extreme nature of this crisis has shown us just how woefully unprepared we are in many respects of caring for patients in a way that's truly centered on keeping patients well, or helping patients to get well, and then keeping clinicians safe. And so I hope there's so much that we take from this experience and really grow from. I'm optimistic, and I've loved seeing that when with people donned with PPE that's so extreme. You look like you're just full on wearing bright yellow or blue gear. No one can barely see your face. I've loved seeing people who've added pictures of themselves to their gowns. I mean, even small things around design to increase the ways that we can connect with one another despite the extreme circumstances have really been, or a transparent mask around the mouth so you can see somebody talking. I've loved getting to see some of those little innovations that people have been picking up around the country.
Yeah, because there's a lot of opportunity of how do we improve communication with our patients when we're wearing the protective gear, when they're in negative isolation rooms, and we're trying to limit contact. And what's been so difficult is when patients are dying in the hospital and their family members can't see them. I think that's been the hardest for me and for other physicians and nurses and healthcare workers to experience of, when a patient is at the last moments of their life and they are unable to get that contact with their family members. But how could we change that? How could we make it safe for family members to come in? How can we improve that communication?
Yeah, it's huge and so important, COVID or not, right? Have you guys been using FaceTime or other modalities to connect people with family, or has technology been helpful at all there?
I've we've been using everything.
Yeah.
So and our hospital, we've had some policies where if it is at the end of life, that we can make it safe for family members to come in, and not a lot at the same time, but because we want to preserve the humanity of
Yeah.
patients and their caregivers and their family members.
Yeah, so important. If you're just joining us, I'm talking with Dr. Bon Ku, emergency medicine physician and author from Thomas Jefferson University in Philadelphia. Please share this live conversation on your own page and be sure to ask your questions now. We'll shortly go into questions from the audience here. So I have a question. What was it like to launch a book in the midst of COVID? I can imagine that's been challenging.
Sure, our publication date was in the middle of March, and we had set up all these book tours across the country, and it was so sad when so many of them got, all of them actually, got canceled. But there has been a lot of interest in our book of applying design to healthcare challenges, and this is the ultimate healthcare challenge that we're experiencing right now. The public health crisis that we haven't seen in 100 years. And so I've been really feel honored by a lot of organizations and institutions contacting us to talk about our book and seeing how they could apply some of the principles and methods to our current crisis. And we've been doing a lot of iteration and prototyping. We've seen people throughout the country applying their creativity to healthcare, because we have never seen a disease like this, and we have to really think outside of the box when coming up with solutions. So it's been refreshing to see some of these principles and methods that we describe are applicable right now to the current crisis.
Yeah. So probably challenging to try to get it out during the world of social distancing, but so important in terms of the content. I mean, it's just so relevant right now. So I'm excited to read it. We have a question from Jessica. All of us could be caregivers at any point. What self-care do you practice as someone who's supporting so many through this crisis?
The self-care, I have to remind myself to sleep and exercise. It's because every one of us, there is no normal day. There's no Friday and Monday and Saturday, they all just blur. And we have, not only in my clinical work, but in our lab, we have a lot of COVID related projects going on. And I feel almost guilty if I'm not working on something. And then sometimes I just feel irritable and tired. My family thinks, "What is wrong with you, Dad?" And I'm going, "Man, I haven't slept that much lately." So I think for me personally, it's reminding myself to sleep, remind myself to exercise. That's important to me, and check in with people. I think that's been really helpful.
Yeah. And you mentioned your lab. Tell us, folks out there who probably aren't used to hearing that there's I assume a design lab within your work. What do you guys do?
I direct a group called the Health Design Lab. It is, the best way I like to describe it is it's like a test kitchen for the hospital, where we are creating new recipes for healthcare. So a current project that we're working on right now is that we are 3D printing swabs for COVID testing, because across the country, we don't have those little sticks that could go into your nose and test for COVID. There's been a shortage of them. So we actually happen to have a lot of 3D printers in our lab because we've been using them before COVID on different projects for making surgery safer through 3D printing anatomy. And we found that there's instructions out there that are open source of how to 3D print these swabs. So we've actually converted our lab into a manufacturing facility for in-house production of 3D printed COVID swabs. So, and like any other good designer, we want to make sure we do some early testing. So many of us in the lab have gotten that stick. We've been testing ourselves with it and making sure
Ouch.
it works correctly. And we have an IRB study that's approved to start using this on patients, because that's going to be critical going forward, is doing widespread testing so we can get better data on this crisis.
Oh, that's incredible. I mean, I'm thrilled to hear that. We know that supply chain has been a big issue around testing. So having more of those swabs, I think, is going to make a huge difference. That's phenomenal. So you created the first design curriculum at a medical school. What are some other changes or additions to the curriculum that you think might prepare our next generation of doctors for the future of healthcare?
For us, we really believe that creativity is a skill set that is needed in physicians, that it's an underappreciated skill. I think it's a skill that creativity can be taught to people. It's not, some people are creative, some people aren't creative. And I think that's a myth. And so we try to teach creativity through design. And it's important when we're tackling these really big, complex problems, and currently with COVID right now. But a key ingredient to coming up with solutions is our ability to think creatively, to think outside the box. So that's one more skill set that we want to give in the doctor's toolkit for future physicians. And what we're seeing right now all throughout the country is some really creative solutions around COVID, from people 3D printing face shields to 3D printing swabs to new types of ventilators being developed. And a lot of that stems from our innate ability as human beings to create.
Yeah, man, I would love to, I'd love to take a class from you. You should do, not just for the trainees, do a master class on design for, maybe you already do this for doctors. I think that's just, it's phenomenal. And the amount of innovation that's coming out right now, people really are trying to pitch in and help, I think, cross sector, and get super creative. So I've loved getting to see that. And I think that's phenomenal that you're training medical students to go out and, especially now, be doing these things. If you haven't asked your questions, go ahead and type them in now. We have another one from Mary. The need for specialized care takes a nursing home patient out of the facility for treatment, and that has resulted in COVID cases upon their return. And I don't know if you'll know the answer to this, but is there a way to bring these specialties, these medical specialties, to the facility rather than transporting the patient back and forth from the nursing home to the facility? Like dialysis, for example?
Yeah, I don't know what context it is behind that one scenario. That's a great question. Nursing homes have been these super hotspots for COVID across the country, and it's been just horrible of seeing some of these nursing homes being ravaged by COVID. One intervention that I've seen promoted is more aggressive pulse oximetry in patients in nursing homes that my colleague, Dr. Rich Levitan, who's an emergency room doctor, really advocates for this because there's a silent hypoxia that occurs where a lot of patients don't experience these symptoms of shortness of breath, and when they arrive to the hospital, it's almost too late. So
Yeah.
what we can do is a lot more aggressive monitoring of a simple pulse ox that goes on the finger, and do that multiple times a day to help diagnose patients earlier if they have signs and symptoms of COVID. And it's a good surrogate marker of how a patient is doing. So that may prevent some of this unnecessary transport, I think, back and forth between facilities. And again, I think about the design of our facilities. How can we better design our hospitals and clinics that to ensure that patients arriving in the hospital do not get infected? So I think there's an opportunity there going forward.
Mm-hmm. We have another question from Francesca. Do you think medical protocols work in a way that goes against creativity? And how do you make them work together?
Yes and no. Yes, healthcare is the most regulated industry out there for good reasons. We want to keep patients safe. We when we come up with innovative solutions, they have to first protect the patient. But I think there's a way to work within these constraints. A lot of designers love constraints. It's adds to coming up with the proper solutions that we need. And I think because of a lot of these constraints and regulations, people don't think there is room for creativity, but I would argue the opposite. I think the healthcare industry is the next field for the design revolution to take place. I think there is a lot of room for a creative mindset of designers to come join us to come up with solutions on how to redesign our whole healthcare system. There's no going back to normal. Healthcare is the largest industry in the U.S., and that there's going to be a new normal. And I think we're going to think about how we redesign everything from how hospitals get paid to our built environment to the experience for patients and providers around communication, around telehealth. So there's no better time, I would say, to invite creativity into this field.
Wow, I couldn't agree more. What a wonderful conversation this has been. Thank you. Everybody tuning in, we want to hear from you all. How has coronavirus changed how you feel about or prepare for serious illness, for caregiving, for the end of life? Please go to endwellproject.org/stories to share your story with us. And tune in next week for New York Times bestselling illustrator and graphic journalist Wendy McNaughton, who will share when she first came up with her daily draw together Instagram lesson for children. It's every day on Instagram. She didn't expect to quickly become America's favorite quarantine art teacher for kids and for adults. So tune in next week for that. And a quick thank you again to our sponsors, the Cambia Health Foundation and the Tauber Family Foundation, for their support. Thank you so much, Bon, for joining us. And to all of you today, it's communities and conversations like this that give me hope in these tough times. So stay safe out there.